beach, want the sand between my feet. I wanna get it bumping.
So you're not doing anything after work, Mom?
No, girl, you know I don't ever go anywhere.
I know, you need to. You need to go have some fun.
You know that's not easy for me. My name is Hope, and a motorcycle accident may have broken my face, but I'm a survivor. I was born in Alabama. From 16 on, I got married, had 2 beautiful daughters. I got divorced. I've been a single mom most of the time. You know what happened the last time I was at the nail salon? That crazy lady looked me right in my face, asked me what happened to my face to make me look like this. So there I am, 33 years old, decided to learn how to ride a motorcycle. Rode around quite a bit, actually, for a couple of months, and then everything changed in the blink of an eye. The next thing I remember is I woke up about 4 days later, laying in a hospital bed, unsure of what happened. I came to find out that I indeed had a wreck. It completely removed my nose. My left eye socket was completely exploded. It took 13 and a half hours in surgery putting me back together. About a week and a half after, I looked in the mirror for the first time and I just cried because it wasn't me looking back at me. I was hurting, I was in pain, I was dysfunctional. I couldn't do anything for myself. I couldn't take care of my kids. And that's pretty upsetting for me.
So your appointment with Dr. Nassif and Dr. Dubrow is coming up.
I know it is. I know it's never gonna be the same. I'm not naive to think that, but I would just like the dynamic on both sides to be the same. It's been a very long, hard road socially, just because people stare. I went from being the life of the party to being a recluse trapped in my own home. I mean, I was never the prettiest girl in the room, but I wasn't ugly. I'm just kind of hoping that they say yes, and
Then we can go out.
heck yeah, we're going
Go
out.
out and party. You guys have to wait till I'm 21 though.
I don't know about party.
I don't know about waiting.
Ooh, Lord, the world better watch out. I'm coming back.
How'd you like my photo?
I thought it was interesting. You did a full Instagram Kardashian model pose. I thought, oh my gosh, the end of the world is obviously here.
Take a look at this.
Whoa! Wait a minute, I don't even understand. Can't even wrap my brain around it. Here's the tongue.
Yeah, that kind of gets you a little nauseated, doesn't it? That's the maxillary dentition. That's your whole
That's
upper
the upper
teeth.
jaw?
Upper jaw.
Here?
Hello. I think it's off, it's gone.
Oh, you know what it is?
Completely
It's
dislocated.
this.
Yeah. I don't think there's even any tissue holding it.
Lisa, they're lucky to be alive.
If we can make her life a little bit better to kind of erase some of these memories, to do something to make her look better, let's do it.
Poor girl.
Can you please send in Hope? Hope Carter, Dr.
Hi,
Nassif.
nice to meet you.
Nice to meet you too.
Hi, Hope. Terry Dubrow. How are you? Nice to meet you. Pleasure.
I mean, it's not very common that Dr. Dubrow and I see patients that have had this severe of a wreck. I really hope that we can help her. First of all, we're glad that you're with us, alive.
Me too.
Have you seen the graphic photos of your mom's face following the trauma?
Yes.
You guys saw it in person or just on the
I saw it
photos?
in person.
You did?
Yeah.
What do you mean?
I was actually with her in the wreck. So,
Just not on the same bike.
yeah,
So you saw this, and how old were you?
10.
You were 10? How old were you?
14.
So what exactly happened? Is that all gravel trauma?
My leg was trapped, so my upper body came over and I face planted the I-beam behind the guardrail.
Oh, God.
Actually, she wrecked in front of a paramedic's house, and he heard a little girl scream.
That was
Obviously,
you.
yeah. And so he came running over, and he had her all ready before, like, ambulance
yeah.
even got there. Like,
So he saved your
yeah.
life.
Hope is very lucky that a paramedic was there. Ironically, the unluckiest day in her life was also, weirdly, one of the luckiest.
How many surgeries to reconstruct your face?
I've had 7.
What'd you do about food?
I had a feeding tube
For how long did you have that feeding tube? Been for a
for
year?
a year, yeah.
Let me ask you a question. When you look in the mirror and you say, this one or two things bothers me the most that you wish you could just make go away?
My eye.
What about your eye?
I don't have two of the same eye.
You have a little unevenness between the eyes?
Yeah. And then they did do a nose surgery. Just the scar tissue on the right side is just really a lot of scar tissue in there. Like if I had to rely on it to breathe, I'd suffocate. And
So you have right nasal airway obstruction.
Yeah.
Could you just tell me a little bit about this emotional journey? Because your mom, who you love more than anything in the world, has a major injury, could have died. She comes home, and what was that like?
I really just don't remember
You don't remember what?
the details of like what I
Having to
did on
take
a
care
daily
of her.
basis.
Did you know that? Is this the first time you're hearing that she's blocking out this whole traumatic incident? How do you feel about that?
Not good. I mean, I feel like what happened to me is nothing compared to what happened to them. Emotionally, I feel like they're always going to carry that. I basically disrupted their whole lives. You know, we'll definitely work on it. We'll fix it.
We've been through a lot. It's been hard, but it's more important to me that my mom doesn't see herself as a monster anymore. My mom is my hero.
All right? I want to feel all around here. So there's a plate here. That's what's keeping your lower eyelid from lifting up, is because everything is stuck right here. This does not feel like normal tissue. You could actually feel the trauma left behind in Hope's face. Nose time.
Oh boy. Good luck now.
Head back for me. All right, let's take a peek. So the opening inside your nose is extremely narrow. Hope has a lot of trauma inside of her nose. It's completely obstructed with all this crusting. I have to figure out what can we do to open up her airway and clean out her nose. All right, let's start with your eye. To get all this reconstructed, first you have to remove that tissue and kind of move new tissue over. See that scar right there? I like to make that scar look better. I'd even like to try to address this and somehow to elevate your left upper lip. The left side of Hope's face is droopy. So what I'm thinking that after surgery, I could add some filler to Hope's cheek and lip to make it more symmetric. Now let's talk about your nose.
Yeah.
You know, the back of your nose, there's a bunch of crust. The best part, and that's why they call us booger pickers, ear, nose, and throat doctors, is when we go back there and we open something up and we see mucus or boogers, we enjoy debriding it. It kind of makes us feel good.
Yeah.
Just so you know.
Just for clarification, we're both plastic surgeons. I am not a booger picker. He's a booger picker. That's his subspecialty.
Yeah. I'm proud to be a booger picker. If we look in the nose and we see a big booger back there, which is dried mucus, and we just grab it and pull it out, love doing that. It is so rewarding. So what do you think of all this?
I think it'll make everything look better and I'll feel a little more confident about it.
Well, we look forward to seeing you.
I look forward to seeing you too.
Unbelievable pleasure
Thank you
meeting
so
you.
much. I'm just excited to be able to look at myself again and not hate what I'm looking at. Oh God. I love you. I love you.
Good morning.
Good morning.
We are actually at that day we're doing this.
I know.
You know Dr. Ping.
Hi.
And then you know this guy, the eye superstar. Dr. Guy Masry is a fantastic reconstructive ocular plastic surgeon. And he's part of our excellent team of surgeons to help fix Hope. The biggest thing that bothers you, number one, this whole area around the eye. Yeah. Two was your nasal obstruction. So we're going to use the endoscope to look and say, okay, is it a deviated septum? Do you have a little bit of valve stenosis where I have to actually open up your nose and make it bigger? I'm not sure yet. We have a gigantic team today for Hope. So we have 6 surgeons today. Because of all the trauma she had, we don't know really how the anatomy is.
Right. So we play it by ear when we're there.
Today for Hope's surgery, Dr. Masri and I will start by removing the metal plate and screws in Hope's left cheek and lower eyelid area, while the team harvests fat from the lower abdomen. Then Dr. Masri will use the dermal fat graft to elevate the lower eyelid, while my team and I perform scar revisions on Hope's trachea and the lower right side of her mouth. Next, we will move on to the nose and use a debrider to clean up and debulk tissue, giving her a bigger airway. Hello.
How are you?
Feel really good.
So I haven't seen you for quite a while. You're looking
Couple of
amazing.
It's been a couple months since I last saw Hope. Breathe. When was the last time you had that?
About 9 years ago.
Yeah.
That's huge.
9 long years to just like, it feels good.
She has been doing great. She can breathe a lot better and her eye is healing nicely. Now all we need to do just to finish things off or to put some filler in her lips and her cheek. She had that tracheal adhesion.
Yes.
So I redid that. And then we redid this scar here.
Very good.
And then she had thin skin and you can feel the plate underneath.
Right.
This lower part of the eye, and she had ectropion. So we opened up that area, took out the actual plates there, and then extended this incision and advanced it.
Amazing.
And we scoped her nose. I had Dr. Frederick help me with this. Now, what is she here today for? Laura, my incredible injector, is going to see about doing a little lift to the left side of the lip. And then we want to give her cheek a little bit of pop with some Voluma filler.
Okay.
Hope still has a lot of healing to do. We're doing baby steps to get Hope back to her old self. Now, we can't change the past, but hopefully Hope and her daughters can start to heal now and move on from that traumatic accident.
Oh, wow, that's crazy different.
Cheek's big.
The cheek is huge, yeah.
I think you look great.
Thank you.
So we will see you soon.
Yes, sir.
You hang in there.
Thank you.
Above it all, we will find the sun above it all.
Pizza Cafe. Yum. That's our favorite kind of place right there, pizza.
All the time.
Coming up on almost 10 years since my motorcycle accident. The way I feel today versus the way I felt then has definitely changed drastically since my surgery with Dr. Nassif. I never would have went out in public. Now, I feel a lot better about myself. I feel a lot better about becoming a part of population again, actually.
Nice to see you with a little confidence back.
Right, you can see that glow in her now. The eye definitely looks good.
The eye definitely looks amazing. I think all in all, the big stuff is done. It's just the little tiny...
Little tweaks.
Yeah, tweaks. The main surgery is done, so yeah. Before my surgery, my face was destroyed by a motorcycle accident. I had a disfigured left eye and mouth. I also couldn't breathe due to my right nostril being closed off from all the scar tissue. I hated what I saw in the mirror, and I hated what it did to me and my family. But now, thanks to Dr. Nassif, I can breathe. My eyes are more symmetrical, and I can finally look in the mirror and not hate what's looking back at me. I'm excited about life for the first time in a very long time. Now we can just enjoy each other without, you know, having to hide in the house or
Get a coffee. When's the last time we got a coffee together?
I don't remember.
We normally go get it and then bring it back home.
Right? I'm pretty excited about that.
Good. It's good to see you happy about it.
Yeah. Finally.